Hello, it's Diego Roig, and I wanted to give you another technique in treating pinky side ulnar wrist pain. And this is hitting the trigger points in the forearm. So when the trigger points in the forearm, tight knots, begin to entrap or compress nerves, that'll radiate pain to the wrist. So you can experience wrist pain that has nothing to do with being from the wrist, but actually originating in the forearm. So what we do is, at the edge of a desk or table, place a towel, like I have this towel, right over the edge, and we're going to use the edge as our therapy tool today. And all we do is, I push myself back from the edge of the table just a little bit so I'm comfortable. I'm going to place my forearm and I'm going to locate my trigger point. That trigger point for ulnar wrist pain is on the ulnar muscle. As you know, it's just a little inside of the bone on that ropey big muscle. Find the height of it, that muscle, and that's normally where the trigger point is, okay, the most tender spot. I'm going to place that on the edge of the desk or table, which is cushioned with the towel, and I will hold that for 12 to 15 seconds. And after that, what I'll do is I'll just slightly move it a little, 12 to 15 seconds. And at about the 9-second point, what I'd like you to do is rotate your wrist. You can do it figure 8, go backwards. Open and close your hand. Stretch your muscles of your forearm. And then I want you to do that for 3 to 5 minutes. Apply enough pressure so that you're experiencing like a pleasure pain, yeah, sweet discomfort. And that way you get that trigger point to release, you break up the scar tissue there, and you experience less ulnar wrist pain. That's it for today. Thank you for joining me.